Hi, this is Jessica DeMassa, and I'm here with Adam Pellegrini. He is the General Manager for FitBit Health Solutions. Adam, we're all curious to know, in terms of wearables moving forward in healthcare, what's going on? Give us a sense of where the market is headed.
Well, we're really excited about where the market's headed, specifically in healthcare. Fitbit itself is going deep into healthcare, and I think that's something that everyone is, the market, our employees, everyone is super excited for. So when we talk about going deep into healthcare, we talk about how do we extend the exciting brand, the aspirational brand that really has led to Fitbit being the leader into a space where we really have been searching for patient engagement. We've been searching for how do we connect hospitals to our patients, how do we connect health plans to their members, and do so in a way that's, again, aspirational, engaging, and actually drives health outcomes. And so I think that the future of wearables really is proving out that the engagement coupled with data, coupled with evidence-based interventions will actually drive health outcomes for an industry that really needs it.
Yeah, and I know we've been seeing a lot, I guess we've been hearing a lot, like up and down, I guess, on wearables, and I think also on other devices that capture patient data, either in the home or in other situations remotely. So as far as like getting patients, I guess, to adopt and engage, or even like in health plans or in provider spaces, for them to adopt and engage wearables, what do you think needs to be done?
Sure. Three things. First of all, I think one thing that will be really interesting for your viewers to know, a little tidbit of data, 6.8 million patients and members and employees connect with their Fitbit to population health platforms today.
Okay.
That is unprecedented at least in my mind, with regards to engagement in the healthcare system with a device and with an experience. So that's really exciting. I would say the one thing that the three things we can really do: one, create interventions that basically wrap around the device, not a device that wraps around the interventions. So we're not thinking just about the device, we're now thinking about how do we create things that can engage and programmatically have the evidence base to move outcomes. So that's one. Two,
are we seeing outcomes?
We are, absolutely. So there have been over 500 clinical research studies done to date with Fitbits alone, with outcomes ranging from the ability to predict length of stay in a hospital, which surprised me, but that work was done by Mayo Clinic. And the fact that clearly we're also looking at outcomes as it relates to patient engagement. We see in some cases 80% engagement rates on some of these corporate wellness programs that we also power with employers today. So I think we see a lot of promise there. And I think the number two aspect of that is how do we make it so that it's accessible to all patients and all members. So this idea of cross-platform compatibility is critical. If you cannot work on iOS and Android from a wearable perspective in healthcare, then there's a problem. And then three, how do we make it so that it's continuous and sustaining, which requires battery life. To be blunt, you have to be able to be engaging, you have to have long battery life, you have to be able to available on the devices that the consumer or the patient has, and connect it to the healthcare system itself, and provide data and insights in a meaningful way for the healthcare system, not just a bolus of data.
Right, and I think it's the insights part that I'd like to ask a little bit more about, because it's, especially right now in an era where we're seeing a lot of artificial intelligence and machine learning using a lot of both structured and unstructured data. How does the data collected from a wearable fit into that?
Absolutely. So insights is core to Fitbit. If you think about some of the features we've recently launched, some of at the core of it, for example, is sleep insights. We have over 6 billion nights of sleep data in our system. That's unprecedented. So layering on machine learning algorithms, we can actually derive insights from that corpus of data, unlike any time ever before in history. So we now surface those insights in the app. Now, take that one step further into healthcare. with some of our platform, our new Twine platform, we can actually distill that data, turn it into insights, and surface it in a contextual way for providers as well as coaches. So it's not just now how many steps did I walk.
Right.
It's sleep coupled with steps, coupled with, right? So they can actually see the full context of the patient and provide that type of care that's actually also exception-based care. So using AI and machine learning, can we make it so that the right people that need help now are being taken care of by humans, because it's not all going to be robots and AI. There's going to be a human involved, right? But for those that actually are doing just fine, or sort of yellow and greens, maybe we take care of them, with humans later. But right now, they're doing fine on their own. So how do we do population health, care management, care coordination at scale? These become really a portion of that, but the real idea is engagement, data, and insights.
Great, Adam. Thank you so much for talking with us. It's a pleasure to hear your perspective on this.
Thank you
Thanks
so much.